Hi friends, welcome to BioGlobe. If you like this channel, please like, share and subscribe. Today we are going to discuss the bacteria Bacillus anthracis. Myself, Mohammad Jasil, a assistant professor of microbiology, Marcus Arts and Science College, Adhavanad. First of all, history. Bacillus anthracis is the first pathogenic bacteria observed under microscope. This observation was made by the scientist Palantar. Second point, Robert Koch formulated the well-known Koch postulates on the basis of observation on anthrax. Third point, the first bacteria to be isolated in pure culture was Bacillus anthracis. The isolation was performed by Robert Koch. First communicable disease shown to be transmitted by infected blood was anthrax. Then Pasteur developed the first bacterial vaccine by using Bacillus anthracis. And germ theory of disease was established with Bacillus anthracis. A lot of discoveries are going under Bacillus anthracis in microbiological history. Then practical importance. It acts as controls in sterilization procedures. For example, Bacillus stereothermophilus strips are used in autoclave and Bacillus subtilis strips are used in hot air oven. And it is used to produce antibiotics. Bacillus polymyxa strain is used for the production of polymyxin and Bacillus subtilis is used for the production of bacitracin antibiotic. As a model in the study of genetics, example Bacillus subtilis. Bacillus subtilis is used as a model for the study of genetics mechanism. Then for pest control on food crops, its Bacillus is always used. Example Bacillus thuringiensis or BT. Then morphology. It is a large gram-positive bacilli about 4 to 8 micrometer in length and 1.0 to 1.5 micrometer in breadth. In tissues, it is arranged in chains, pairs or singly. In culture media, it is arranged in long chains. Ends of bacilli are swollen and truncated, giving the bamboo stick appearance. So, the morphology of Bacillus anthracis is like bamboo stick appearance. They possess spores which are oval, central and non-bulging. It is always formed in culture or soil. They are non-motile organism and the entire chain is surrounded by polypeptide capsule or it is known as capsulated organism. Then amphibians reaction. It's the most important reaction in the case of Bacillus anthracis. The blood films containing Bacillus anthracis when stained with polychrome methylene blue and it is examined under microscope shows an amorphous purplish material around the bacillus which represents capsular material and is a characteristic feature of Bacillus anthracis. This is the picture of amphibian reactions. This is always look like bamboo stick appearance and capsular material are forming outside the bacillus. Then cultural characteristics. Bacillus anthracis is aerobe and facultatively anaerobes. The optimum temperature is 37 degrees Celsius. The temperature range is between 12 to 45 degrees Celsius. Then optimum pH is 7 to 7.4 and it can grow on ordinary medias. Then what are the media and colony characters of Bacillus anthracis? On nutrient agar, it forms large 2 to 3 millimeter in diameter colonies, raised, dull, opaque and grey-white colonies with irregular edge. Then under low power microscope, the colony gives frosted glass appearance. Frosted glass appearance is one of the important peculiar colony morphology of Bacillus anthracis. The edge of the colony shows medusa head appearance, that is long interacting chain of bacilli resembling curled matted hair. Curled matted hair like appearance of bacilli is known as medusa head appearance. On blood agar, this is the colonies are formed like nutrient agar and slight or non-hemolytic colonies are formed on blood agar. This is the picture of frosted glass appearance of colonies on Bacillus anthracis. Then medicide appearance. The colonies are long interacting chain of bacilli resembling curled matted hair. This is one of the colony of Medusa head appearance colony of Bacillus anthracis. Then selective media. What are the selective media used for the identification of Bacillus anthracis? One of the selective media is PLET media. PLET media containing heart infusion agar with polymyxin, lysozyme, ethylene diamine, tetraacetic acid, and thallus acetate. This expansion of PLET, that means polymyxin, lysozyme, ethylene diamine, tetraacetic acid, and thallus acetate. Then gelatin stab culture. What are the colony formation on gelatin stab culture of Bacillus anthracis? On gelatin stab culture, they form inverted fir-tree appearance of colony with slow liquefaction commencing from top solid media. This is the picture for the formation of fir-tree appearance in gelatin stab culture of Bacillus anthracis. Inverted fir-tree appearance is mainly by motile strains, and non-motile strains does not form any inverted tree appearance colonies. Then string of pearl reaction. One of the important reaction occur in Bacillus anthracis. On solid media containing 0.05 to 0.5 unit of penicillin per ml is used as a string of pearl reaction media. The cells become large, spherical in 3 to 6 hours and appear in chain on surface of agar. This is the picture of string of pearl reaction. Then biochemical reactions. Biochemical reactions are not at all important for the identification of Bacillus anthracis. They ferment many sugars with acid production, catalase test positive, and they reduce nitrate test. Then resistant or sensitive factors. In vegetative state, bacilli are sensitive to physical and chemical agents. However, spores are highly resistant to both these agents. Spores may remain viable in soil for about 60 years. That is a miracle thing. Spores may remain viable in soil for about 60 years. Dry heat at 140 degrees Celsius for 1 to 3 hours and boiling kills the spores of Bacillus anthracis. Then dickering is the process result in spore destruction in animal products where 2% formaldehyde at 30 to 40 degrees Celsius for 20 minutes is used for wool and 0.25% at 60 degrees Celsius for 6 hours for animal hairs and bristles. This is the term of dickering. And disease caused by, what are the disease caused by Bacillus anthracis? Bacillus anthracis causes a zoonotic disease that is known as anthrax. What are the clinical features of Bacillus anthracis? Then modes of acquiring infection. Mainly Bacillus anthracis acquire infection through skin by inoculation, second one inhalation, then third one ingestion. In most of the cases, disease is contracted as occupational hazard due to contact with the meat, hide, and hair of infected animals. In others, it is due to handling of infected animal products such as shaving brushes and leather goods. Then what are the clinical types of Bacillus anthracis? Mainly 3 types of clinical forms of Bacillus anthracis are: first one cutaneous anthrax, second one pulmonary anthrax, third one intestinal anthrax. First one cutaneous anthrax, something related with the skin. Common in dock workers carrying loads of hides and skin on their back, it is therefore called hide porter's disease. Cutaneous anthrax or anthrax is also known as hide porter's disease. It is also called malignant pustule. Hide porter's disease is due to the dock workers carrying loads of hides and skin on their back. Therefore, it is called as hide porter's disease. The infection is acquired by inoculation of spores through skin. What are the sites that are affecting cutaneous anthrax? Mainly affecting face, neck, hand, arms and back. Then what are the formation, what are the peculiarities of lesions, importance of lesions. Lesion starts as papule, it's become vesicular, containing clear or blood-stained fluid. The infected area becomes edematous and congested, leading to necrosis at the center covered by black ichor. Satellite lesion appear surrounding central lesion. Papule means small pimple or swelling on the skin and often forming rash. Then vesicle means small fluid filled bladder or sac or vacuole within the body. Then congested means filled with blood or full of blood. Then black ichor means dead tissue that eventually dispose a healthy skin after an injury. Then complications are untreated patients develop fatal septicemia or meningitis. So, fatal septicemia and meningitis are the complications of Bacillus anthracis infection that is known as anthracis. So, this is a picture of cutaneous anthrax. Then pulmonary anthrax. Pulmonary anthrax is mainly common in wool factory workers, or it is also called wool sorters disease. The infection is mainly acquired due to the inhalation of spores from infected wool. So, it's a respiratory tract infection that is known as pulmonary anthrax. Infection is acquired due to the inhalation of spores from infected wool. Then, two manifest conditions are there for pulmonary anthrax. First one, hemorrhagic pneumonia, then complicated stage that is known as hemorrhagic meningitis. This is the picture of X-ray picture of pulmonary anthrax. Look at this picture. The lungs is filled with hemorrhage or blood filled. Then intestinal anthrax. It's a rare form of anthrax present in the Bacillus anthracis. It's found in community who eat improperly cooked infected meat. When a meat is infected with Bacillus anthracis, those meat is improperly cooked, this disease to be come under. Then clinically the patient presents with bloody diarrhea. The main manifestation or clinical manifestation of this disease is bloody diarrhea. So when the patients to be ingested the infected meat, the following symptoms are there in the patient's mouth. Look at the picture. This is the picture of intestinal anthrax. Then laboratory diagnosis. What are the methods to be adopted for the laboratory diagnosis of Bacillus anthracis? First one, specimen. What are the specimen to be collected for the identification of Bacillus anthracis? Blood, sputum, fluid or pus from malignant pustules, then gastric aspirate and stool sample are always collected. Then microscopical examination, gram staining, we get gram-positive bacilli with capsule. Then Indian ink preparation, forming clear halo around bacteria, they are present capsule. Then Giemsa stain forming red capsule around purple bacillus. Then direct fluorescent antibody test is used for capsule detection. Then amphibians reaction forms an amorphous purplish material around the bacillus. Second one, animal inoculation, intraperitoneal inoculation of bacillus sample in mice or guinea pig is always done. Then blood smear is observed after death of animal for bacilli. Then antibody detection test is mainly done by using ELISA test and indirect hemagglutination test. Then antigen detection is done by Ascoli's thermoprecipitation test to detect antigen in tissues. Nucleic acid is always detected by using polymerase chain reaction or PCR. What are the treatment and prophylactic measures adopted for Bacillus anthracis? The treatment for the treatment of Bacillus anthracis, mainly 4 types of drugs or antibiotics are used. First one penicillin, second one streptomycin, third one doxycycline, and fourth one ciprofloxacin. Then prophylaxis include alum precipitated toxoid is prepared by using protective antigens. It is used in occupational risk groups. What are the schedule of this vaccine? 3 doses are get intramuscularly at an interval of 6 weeks between first and second dose and 6 months between second and third dose. This is all about prophylactic measures of Bacillus anthracis. Thank you for watching this video. If you like this channel, please like, share and subscribe.